some of the talks today. Firstly, I'd like to introduce Professor Lee Kennedy. Professor Kennedy is an endocrinologist, which is a hormone doctor, but specifically treats a lot of diabetes. So he's going to talk a few minutes on diabetes, and we'd like to offer people to ask questions as much as they can. So just thank you, Lee.
Right, thank you very much. It's a great pleasure to be here. I had no idea how many people would attend this thing this evening. So I'm just going to say a few words about diabetes, but as Raven says, I'm really happy to take any questions. So as you probably all know, diabetes is an incredibly common disease and is becoming commoner. In Australia, somebody new is diagnosed with diabetes every few minutes. And in the world now, we're heading for having about 300 million people with diabetes. Now 7% of the adult population. So it's a really important disease. It's a disease that we often don't know we have it for a very long time. It creeps up on us. It does cause symptoms. It can cause you to feel thirsty. It can cause you to pass a lot of water. A lot of people with diabetes feel fatigued. They feel that they don't have a lot of energy. Sometimes they lose weight. Often they're overweight. As I say, many people don't realize that they're developing diabetes. It is an incredibly easy disease to get. I suppose I was supposed to be telling you how not to get it. It's actually difficult not to get it and easy to get it. And the things that make it easy to get are, first of all, many people in the population have a family history of diabetes. And type 2 diabetes in particular is very strongly inherited disease. So if you've got a family history of diabetes, you should be very careful to avoid the risk factors for diabetes and to be screened for the condition regularly. The second thing that's making it very common in our populations is that we're getting older. Our population is aging. In Australia now, the average life expectancy for both a man and a woman is over 80. And the older we get, the more likely we are to develop diabetes. And the third thing is body weight. Because if we look at our population now, and if you looked at it 10 years ago, 20 years ago, 30 years ago, the population in general, and many of us as individuals, are getting fatter. And being overweight is a major risk factor for diabetes. So you can't necessarily avoid getting diabetes because we all get older and we're born with the family history that we're born with. But the things that you can do is to watch your body weight. You keep your body weight within recommended ranges, and particularly for men, to watch for abdominal gain in weight. Belly fat really does predispose you to diabetes. Not just avoiding being overweight, but watching the sort of things you eat. Avoiding refined carbohydrates, keeping your salt intake down, keeping your intake of saturated fat down. These are all important factors. So even if you don't manage to perfectly control your body weight, looking at the quality of your diet. And where necessary, getting advice on that. The third thing, and there's plenty of exercise professionals in this room, is to exercise regularly. Exercise is often a bit disappointing in terms of losing weight, but there are many health benefits of regular exercise. Half an hour, several times a week. Half an hour, most days of the week. And I think we're not just talking about strenuous, overwhelming exercise in the gym. We're talking about day-to-day activity, living more active lives. And I guess the final thing really to highlight is trying to get some of the stress out of our lives, because many of us lead pretty stressful lives. And to try and identify where your stress is coming from and to deal with your stress and to try to rub along with people. It's not always easy to rub along with people at work or in the family, but try to form placid, peace-forming relationships. Try to get along with people and get some of the stress out of your life. These are the sort of main ways, if you can, to avoid getting diabetes. Thank you.
Thanks, Lee. You can stay there. I'll ask a couple of questions quickly. So when do you think is the best time for screening for diabetes? When should a bloke go and say, I want to get checked for diabetes?
Well, you know, we're seeing people younger and younger with diabetes now. We're seeing people in their teens with type 2 diabetes. So if you've got risk factors, you should be screened really throughout your life. But if you're generally a fit and healthy person, I guess we begin to get a bit worried beyond the age of 45. You should be probably having regular health checks.
And just inform the audience about how it is checked, diabetes these days?
Just a single finger prick blood test. Some of you have had that this evening here. But I guess to really formally confirm the diagnosis, and it's important to do that because lifetime of treatment is based on the initial diagnosis. To formally confirm that, we would have some laboratory blood tests. Very simple tests.
Lee, can you make a comment about treatment of diabetes, please?
The treatment of diabetes now is very, very complex. And I think it's very easy to think that there are a lot of new medications for diabetes, and for people who need insulin, there are a lot of different types of insulin, so that the pharmacological management of diabetes is more effective than it's ever been, and it is quite complex, which is what keeps people like myself in business. But I think it's really important not to think that this is a condition that can be cured by medication. It is a disease of lifestyle, and lifestyle factors, diet, exercise and stress, are incredibly important.
And sorry, Lee, when you have a treatment, a checkup for diabetes, how often would you recommend it, say, if you're a 45-year-old bloke?
Every year or two. I think you should visit your doctor or visit your health professional. And at any time when you develop symptoms.
Can diabetes be reversed over time? Is there anything that you can do to actually reverse it?
You can reverse type 2 diabetes, but you have to work very hard at it. It's quite difficult because by its nature, it's not a disease that just develops and that's it. It's a disease that develops and progresses. And so you've got to halt that progression and reverse the biological processes that are going on. And that usually requires quite strict dieting, quite active approach to your exercise, and getting all the other stresses and things out of your life that might be contributing to the condition. But yes, it can be reversed.
Terry, you had a question?
That was part of my question.
Yep.
So basically from what you've answered there, it's more of a disease that you should try to manage.
Yeah.
So sorry, Terry's just saying for everyone that's more a disease you should manage.
You do have to manage it because it's not. We shouldn't be painting a bleak picture because many people in the world live a perfectly happy and fulfilled life with diabetes. But you have to be mindful that it is still the most commonest cause of kidney disease, particularly in younger people. It's a common cause of eye problems. It contributes to heart problems and strokes, and other aspects of your health can deteriorate with it. So it's a lifestyle condition, but it's one that you've got to take very, very seriously.
Any other questions at the back there?
Fortunately, are women at higher risk than men?
I think that's what a group like this would like to think. but actually no. Actually no. Women. It's true that in earlier life, women who go through pregnancy sometimes develop diabetes, and that's an important risk factor for diabetes in later life. But I think as men, we can be a bit complacent about our health, and we're probably less likely to go and have things checked out. But we're no less likely to develop diabetes, and we are more likely to develop heart disease in earlier life.
Yes, mate?
I don't mean to be disrespectful in any way, but you go to the doctor, you say you're smoking, you give up smoking, and then the next minute you put on weight, and the next minute they tell you to lose weight.
As a professional,
really mean that. I find it hard.
Sorry, just the question for the people at the back was, he was concerned that giving up smoking can put on weight, and then the doctor tells him to stop weight.
Giving up smoking puts on weight.
Yes, that's what I said. Yes. So then the doctor tells him off for putting on weight. So yes.
Yeah.
I think as a profession we're never happy, of course, and so that's a way of it. But I think we kind of are learning to practice medicine, and Rav would be a very good example. We're learning to practice medicine in a way that encourages people and not discourages people, because if each and every one of us looked at objectively at our health, there would always be something or many things that are negative. And I think the thing is really for us to work on the positives.
That's what I said. I don't mean to be negative.
No.
How do we lose weight?
Losing weight is very, very difficult. It's very, very
We'll
difficult.
answer that a bit later, mate. So we've got the dietitian and we've got the exercise people to come. So don't worry. We'll get you on the treadmill soon. Yes, Normie.
Lee, just other hormonal changes. So, we're getting older. I find it really hard to lose weight. This gentleman, obviously, for his own reasons. But me, I do a lot of exercise, and still, it's hard to drop the weight.
It's, weight loss is incredibly important, and exercise can be very disappointing, particularly as you get older. You can get stronger with exercise quite easily, but it's harder to get thinner with exercise. And there are a number of hormonal changes that accompany aging, not just the development of diabetes or the forerunners to diabetes. There are a number of other changes in the hormones that contribute to changes in your body composition that make it harder for you to get fitter and to lose weight.
Such as?
Well, testosterone levels, for example, in men decline as you get older. Other hormones decline. Changes in thyroid function and the pituitary gland function become more common as you get older.
So these things that you can proactively do something
Yeah. You can have things checked so that you can identify problems. And if there are problems, then the nice thing about endocrinology, which is my specialty as a medical specialty, is that most things can be put right. If you produce too much of a hormone, we can stop you doing that. If you don't have enough of a hormone, we can give it back to you. And that's what we do.
Yes, Sinead?
You're not a man.
From the radio station.
Probably.
Do men actually have anything regarding hormones like menopause? What do men?
This is quite a controversial area. We sometimes use the term andropause, which is a sort of similar process to menopause in men, but it doesn't happen so dramatically in men. And so the metabolic changes and the hormonal changes that take place with aging probably happen more gradually and less perceptibly in men. But they're no less important in terms of their impact on your health and life expectancy.
What are the hormonal changes in relation to the pituitary?
Well, the regulation, particularly of testosterone production, takes place at the pituitary level, and the growth hormone and the thyroid are also regulated by the pituitary gland. So pituitary gland is quite a complicated gland that produces about 6 or 7 different hormones, and all of these, the production of all of these is affected by the aging process.
One more from David over there, thanks.
Bearing in mind that dementia and increasing in numbers, diabetes too increasing in numbers, has there ever been an established connection?
Oh, very much.
I'll
Yes.
just, so the question was, has there been an established relationship between dementia and type 2 diabetes, as they're both regarded with aging?
Type 2 diabetes and the forerunners to type 2 diabetes affect many aspects of your health, including your psychological health and your cognitive function. And there's a very strong relationship between overweight and diabetes risk and type 2 diabetes and the risk of dementia and decline in neurological and cognitive function, brain function, as you get older. So it's a really important thing, because I guess some of us take the attitude, if you're going to have a heart attack, it's just going to happen. It may happen someday, it may not happen. But one of the things that really does worry us as we get older is that our mental functions might begin to decline. That you won't be able to do the things that you like to do. That your concentration and your memory might begin to go. So the whole thing around type 2 diabetes and managing your weight is important from that perspective as well.
may just leave it there, and if there's any questions at the end of the night, or if you want to come and quickly chat to Lee later on, I'm sure he'd be happy to take some questions. So Lee, thank you very much.